Hello, guys. It's Professor Tasha here again. Sorry again today about the connection problems we were having on the conference call. I thought by using conference call that would be a way for most of us to get on, and then we could do a good review. So I apologize that it didn't go the way I thought it would go. So let's do, I'm going to go back over some things that I talked about on Blackboard Collaborate and then on the conference call as well. I started off talking about medications. So some medications that you need to be aware of for this exam are omeprazole, which are proton pump inhibitors, Zofran, and also Compazine, which are antiemetics, so they're used for nausea and vomiting. And then NSAIDs. Anytime you have GI distress or GI problems, you want to be cautious about using NSAIDs, okay? For the risk of GI bleed, of course. For these medications, you probably want to know indications for use. So what are they for? Also side effects and also abnormal lab values. Along with that, you need to know the difference between an adverse reaction and also just a regular side effect. Adverse reactions are rarely things that rarely or never happen. Side effects are your normal nausea, vomiting, dry mouth. Okay, so just know the difference between those. Iron deficiency. So you want to make sure that you know which. So who's at risk for iron deficiency? Also, some signs and symptoms of that as well. Colostomies. So you want to assess persons who particularly has a new colostomy. You want to be able to assess body disturbed images. And so what are some signs and symptoms of that? What type of things would your patient be displaying, such as not wanting to participate in care of the ostomy, things like that. GI bleed, priority assessments. Also want to be sure to know which assessments are priority. You'll probably be given a lot of them. You have to be able to prioritize which one comes first. Nephrotic syndrome, want to know care of the patient, interventions for this patient. Also, CAUTIs, catheter-acquired UTIs. Catheter-acquired UTIs, you probably want to be aware of use of Foley. So research says that increased use of Foleys cause infection, right? But there are some patients who have to have a Foley. So with those patients, you want to know care of the Foley to prevent catheter-acquired UTIs. Also, bladder infections, common symptoms, that frequency, urgency, and dysuria. Also, you want to know how to care for a person with a bladder infection, and also the causative organism causing that. Urinary incontinence causes. So you want to know causes and also treatment as well. Dipstick. You want to know what's on a dipstick as well. A dipstick is used to see if a patient may be at risk for infection or whatever is in the urine. So you want to know dipstick, and you want to know what to do with that. Esophageal varices, you want to know that's a bleeding risk, so make sure that you're aware about that. Also, I would highly encourage you, if you haven't listened to my lecture on liver, gallbladder, and pancreas, go back and look at that, okay? Renal stones, priority treatment. You want it's very painful, so you need to be able to prioritize care with that as well. Diarrhea, what is the biggest risk, of course, for that? Of course, dehydration and electrolyte imbalance. TURP procedure, TURP. You need to know when that is done. Also, you need to know what the urine concentration looks like before the CBI and after. CBI is complete bladder irrigation. Appendicitis, no heat to the abdomen, of course. Peritonitis, you want to know care for that. Also, I'd encourage you, peritonitis and appendicitis, those were on my upper GI video. Go back and look at that as well. And then diagnostic studies, ERCP and also EGD. Really, really important with those guys. Gag reflex. You want to make sure that is returned before introducing any food to the patient. That's a safety concern. Also, some other things that I don't have listed on my paper. Cholecystitis, also choledocystitis, which is gallstones within the gallbladder, and then inflammation of the gallbladder. Those things, make sure that you are really, really, really familiar with that. Know the difference between cholelithiasis, cholecystitis, and also choledothiasis. So know the difference between those three as well. Math, you're going to have about 8 math questions on your exam. So brush up on your IV skills. There's one IV question, I'll tell you that. Make sure you know how to do that as well. I think that is it. If you have any specific questions, please give me a call. If I didn't make this clear enough, just call me, okay? So make sure you're studying, going back and looking through those videos. It'd be really helpful for you, all right? So happy studying. Hope you guys are doing well on the inside. Get out and get you some air. Don't stay cooped up in the house because depression will set in. I got out the house to get in my car, went for a little drive, came back to the house. So make sure you're getting up, moving around, and also, above all, make sure you are studying for this exam. Talk to you later. Have a good evening.